My assignment today is to talk about some of the methodologies that we've used to try and understand service and the service that we provide in cardiovascular surgery. How did we get here? Cardiac surgeons are not generally thought of as particularly touchy-feely, warm and fuzzy, in tune with their, harmonic selves or something or other. I don't know. The way we got here actually again was a merging of interests. I had an interest from a fairly clinical standpoint about reducing pain, experienced pain. I've got a pet peeve about minimally invasive surgery and what is minimally invasive and what is it to be truly minimally invasive and so on and so forth. And I thought that regardless of the size of the incision, if you dope somebody up and keep them awake and all of those awful things we do during a hospitalization, that's not minimally invasive, regardless of whether the incision's this big or that big. And the other component was Brent Phillips, who was the administrator with us at the time, was very tuned into the experience and sort of the economic side, frankly, of the experience economy and what is it to provide an experience and what is it that Starbucks and those sorts of companies have figured out about experience and how can that increase interest in people traveling to see us to have their care. So those things sort of came together and fostered the generation of what ultimately matured to a healing enhancement program. Brent encouraged one of the administrative interns to actually videotape the experience of a patient in the hospital, what it's like to go through the hospitalization from the standpoint of the patient, with the goals of the program being to understand the overall continuum of care. Independently, we give great care, but we didn't really, as cardiovascular surgeons, understand the whole continuum as it was perceived by the patients, and to determine the needs of our patients, the recognized and unrecognized, the spoken and unspoken needs of the patients and families, and create a sense of urgency and commitment to the patient care experience. There's nothing like showing videotape to create a sense of urgency in your colleagues. We all know that. This experiment, this is a psychology experiment, a very famous psychology experiment, and please don't share the answer with your colleagues. And the importance of this is to understand about attention and focus and how we perceive what it is that we're looking for. So what I want everybody to do is count the number of passes of basketballs from people in a white shirt to another person in a white shirt. Now, this is an example of real life. There are other things going on. There are people in black shirts passing basketballs back and forth. So this is the chaos that's around us. And I want you to all count the number of passes, and then when we're done, we're going to compare. We're going to see how many people, what the distribution of counts of passes was. Okay, so remember, we're counting passes from people in a white shirt to people in a white shirt. And count them. You can write them down if you want to. Keep track. White to white is all that counts. The number of passes. And we're going to see how many people get it right and what the distribution is of people counting how many passes those are. And I think it'll show you how difficult it is to actually come up with a number for what seems like a pretty simple task, counting the number of passes of the ball from one to another. So somebody give me a number. How many passes white shirt to white shirt? 17? 17. Anybody get 16? Raise your hands. Okay. And 18? So, and 17. Let's see the 17. 17 is the majority. Okay, and how many saw the gorilla? So now let's look at it again, and don't count the passes. And if you didn't see that, unfortunately, I'd been told the solution to this before I even saw the video, so I didn't get to experience this. But this is actually a pretty famous psychology experiment. And it shows that you don't see what you're not looking for. Now, the question that I have for those of you who didn't see that gorilla, you didn't see a gorilla walk on and off this and actually wave at you. Now, isn't that staggering? So you don't see what you're not looking for. That when we have shown this video to the whole video, to the caregivers, and we can sit back and see the gorilla and objective about it. There are so many missed opportunities to provide superb service and to meet needs, and yet when Mr. Hosey's speaking, he's so delighted to be alive that yep, it was a great experience. So if we ask him as a patient at the end of it, which is what we usually do, right? We say, so what could we send you a form and it says, what could we have done to make your stay better? We're not going to get any information out of it because he's just happy to be alive. And we wouldn't have captured any of these opportunities to improve things if we had not videotaped. So the power of observation, 214 at least. How many passes of the basketball? Probably more, right? Opportunities were identified to improve things. We created 7 areas of focus: space and decor, at least in the areas that we can control. On the ICUs, or on the ICAs, our step-down units, we've changed the way that we put art up on the walls. We spoke with patients through the Healing Enhancement Program. We spoke to patients, found out what kind of art would you like on the walls, and most folks around these parts would like rural scenes, and so we've got lovely sort of farm scenes and such, which is, I think, delightful. Area of focus about customer service, duplication of services. We've centralized the preoperative experience, so instead of moving to 7 different spots, we can get it all done in one spot. So they're not making these trips all over creation. We've moved the mountain to Muhammad. We bring the phlebotomist to the patient instead of the patient to the phlebotomist, all those kinds of things. Leadership, communication, pain and anxiety. We have a whole program in pain and anxiety, and that's where I've become interested in complementary medicine, things like acupuncture, so on and so forth. Massage, we've got a huge program in massage, and we've shown benefits in terms of pain and anxiety with regard to massage and other aspects of patient care. As I say, Alfred 1, we've reduced the patient stops from 8 different stops to 3. The Healing Enhancement Initiatives, which Ryan would be glad to share with you, the other aspects of what we've done in addition to massage, guided imagery. I send guided imagery, we all do, send guided imagery tapes to our patients before their heart surgery. If you told me we'd be doing that 5 years ago, I would have thought that was a little wacko. But, you know, it's no surprise that people have cognitive dysfunction after heart surgery when we have scared them to death, kept them awake, filled them with drugs, and then booted them out the door and said, good luck, your grafts are open. Of course, for 3 months, they're trying to figure out which direction is up. We are very conscious of our pre-appointment materials that we mail out. The patient menus, this wouldn't surprise you that there are issues about the menus. One morning at a division meeting, Brent organized for the dietary folks to serve us, the cardiac surgeons, breakfast. The breakfast that our patients have. And it wasn't quite what we had in mind. So the needs of the patient do come first, the patient and the family, the needs and the unspoken needs, and we've tried to look at the whole continuum of care, pre-op, day of surgery, and post-op. There are hidden assumptions that become so much a part of the way we conduct our daily activities. That's what Edgar Schein would call the hidden assumptions about our culture that recede from our awareness. That when you buck up against them and challenge them, people think that you're crazy. That's how Edgar Schein says, you know, you've hit a hidden assumption when people think you're crazy. And there are some people who think I'm crazy. It's hard to change culture because there are a whole host of hidden assumptions, and most of us aren't aware that they're there any more than they saw the gorilla. This isn't the way that we're trained in medical school to think about these kinds of things. We're scientific, and we're especially in a field like mine that's highly technical. We've completely focused on the technical aspects. I believe I'm quoting Schein correctly, that the only changes that you can make that will shift culture are changes that solve a practical problem. So first you have to open people's eyes to the problem so that they see the gorilla. And once they see the gorilla, then I think the solutions become self-evident. So I think that the first job that we have is helping people to see the problem. Once we see the problem, I think we can fix it. But that, I think, is the hardest part of the whole thing, is seeing the gorilla.